Language of Caring helps healthcare organizations achieve an unparalleled patient experience and a culture of caring through exceptional communication.
We really wanted the language of caring to help augment the interactions that our staff have and our associates have with every patient, every family, and each other. We know that that will create the culture of caring and loving and making certain that each patient has what they need and when they need it. And emotion is something that we obviously deal with every day here. Our own emotions about a child living or dying. We understand the parents' emotions about what's going on with their child, and then obviously the clinical work that we must do in order to help that child. So understanding that emotion and being certain that we recognize it, that we acknowledge it, that we really care about each one of them, which every one of our associates does, makes a huge difference in how we interact with our families and our patients. I have what I call Rhonda luncheons once a month, brown bag luncheons. I ask about language of caring. To a person from the time we started it, there were a few things that they will say. One is, it feels really good to know that the leadership acknowledges that this is important to them because it's important to us as care providers. The second thing they say is that even though we had a family and patient-centered approach to our care, that this has just enhanced it tremendously. And the third thing that they say is they feel that even though they were kind to their colleagues, they are much kinder now. Language of caring has had a huge, huge impact on the coworker relationships. Each person that comes to work here has something going on at home. They may have children, they may have a dying husband, they may have a dying parent, whatever is going on. To acknowledge those same feelings with a coworker and create that kind of culture is as important as creating it with the patient and the family. Language of caring is for everybody. It works in our homes. It works with each coworker. It works with a visitor in the hallway. It's an important way of acknowledging people, being caring about an individual, and recognizing that if we don't look them in the eye and really try to see and hear what's happening with them or what's going on with them, we can draw conclusions that are totally inappropriate. And so really using it with every interaction that we have is what our associates say. And at my luncheons, that's what they acknowledge, how important that has been to them. If I were giving advice to a CEO about implementing language of caring, I would give them a few bullet points, if you will. The first is truly understand language of caring, and not just intellectually, in the heart. The second would be, don't hide in your office. Be out there, rounding, asking how the language of caring is going. Has an associate felt or seen or experienced a difference with their patients or their coworkers? And the third would be acknowledge those who have really embraced it and who love it and who have examples, good, real stories about how it has worked.